carers are doing in excess of 3.5 million hours of caring work every week of the year. And you can get employed to do this type of work with the health services, and they pay about €13 an hour. So using that figure, Irish carers, those 161,000 carers, are contributing over €2.5 billion to our economy by means of their labour every single year. And what we're saying is that that is a very concrete evidence of how family carers are actually supporting our health services by maintaining people at home who couldn't stay at home if they didn't have a carer to look after them in many situations.
You're a great girl. Well, I'm sort of prepared for it because the daughter in Jersey turned around and told me she's working with people that has the Alzheimer's and has dementia. And she turned around and she says, well, Dad, it's not going to get any better. It's going to get worse. Now, to be fair to my doctor is turned around and he said, well, you know that she's going to get worse. I'm thinking about putting her into a home. But the thing about her is, I know myself, if she went away from me, within 2 weeks, she could be gone because it'd break her heart.
Many of these people just want to live in their own homes, they want to die in their own homes. And unfortunately, due to very serious illnesses or disabilities, or even in some cases just extreme frailty and old age, they can't manage as they used to manage, and they just need someone to help them with the daily tasks.
Okay, you're all right, relax, you're all right, relax. We're 50 years married. I wouldn't be able to leave Esther, you know, let her go into a home.
We know from the statistics of the census that there's somewhere in the region of 40 to 60,000 carers who are actually providing full-time care. They are there 7 days a week and they are on duty for many, many long hours. Now, we know for a fact that if they could not provide that service, their relatives would have to go into institutional care. Now, most of these people qualify for the carers allowance, and the carers allowance is something like €2 to €3 a day above the unemployment rate. So for a very, very good value for money, the state is getting a 24/7 service. Whereas if those people had to go into institutional care, it would be extremely expensive on the state, because many of these people have very limited income and couldn't afford to be going into private care.
Shane just needs care from the moment he gets up in the morning. He's obviously not toilet trained yet because he is quite severely affected with autism. So it is a matter of changing him, usually washing him first thing in the morning, taking up his bedding, and then feeding him. And then once we leave the house, really, I have to really take care of him as if he were a toddler.
We have about 260 respite care staff in our organisation, and we delivered in excess of 160,000 hours of home care last year. Now, this is with funds that we get mainly through the health services, so we work on a contract basis with them. So we're recognised as a very important part of the delivery of that service. And the carers we're supporting, of course, we're only going in for a small number of hours.
Monica has started with me just about 4 weeks ago with the Carers Association, who provided her for 4 hours a week. It just means that I don't completely burn out. Shane is getting to do something he really loves, which is go home and be cared for and be given attention and reading books. Things that I do, but I can't do as much as I would like, and he needs a lot of attention.
The Carers Association is part of the Social Partnership Agreement, and we negotiated with government as part of the 2016 agreement that they would formulate an overall carer strategy that map out in the coming years what needs to be done to support carers. And we had agreed the areas in which they would look at in relation to training, in relation to support services and other aspects like that. And the government have drawn up this policy document. We were told they have it done by December just gone, but due to the economic crisis they have decided that it's not priority enough to deliver on it now and to publish it now. So they've decided, because they haven't the money to do this, that they're not going to produce the strategy. So you have to ask, where are their priorities in dealing with particularly the 50,000 carers who are full-time carers in the home, and an essential part of our health and social services. The government are turning their back on them in relation to formulating and producing this strategy.